So the first bone we're going to look at is the sphenoid bone, all right? And as you can see, the sphenoid bone looks like an owl, right? Here's the beak of the owl, here are the wings of the owl, here are the feet, the claws of the owl, all right? Now, we're looking at it in the anterior view, so you're looking right at someone right in their face. And the sphenoid bone is going to be right, and we'll show you later, is going to make up the back or posterior aspect of the eye socket. Here's some of the big landmarks you need to know from an anterior view. Here's the lesser wing of the sphenoid, okay? And the biggest landmark are these huge wings. This is the greater wing of the sphenoid. This is the anterior aspect of the greater wing of the sphenoid. Again, lesser wing of the sphenoid. Here's the nose, or the beak. Rostrum means beak, so here's the beak of the owl. So there's the rostrum. This is the superior orbital fissure, okay? Now you're going to have a lateral plate, so this is the pterygoid, okay, process. That's a lateral plate. And here's the pterygoid process, the medial plate, which makes sense. This is closer to the midline, and this is farther away from the midline. So we're still looking at the sphenoid bone. It's an anterior view, and again, you can see the sphenoid bone. Here's the greater wings right in that posterior eye socket, okay? We have the lesser wing of the sphenoid, and again, the greater wings of the sphenoid, the lateral plate, okay, medial plate, but then you have some openings, all right? So foramen means an opening. So you have the foramen rotundum here, and then here you have the aperture for the sphenoid sinus. So sometimes you can get infected sinuses, and sometimes that sphenoid sinus can get congested. So again, this is an anterior view. We're looking someone right in the face. And here you can see the greater wing of the sphenoid here, okay? All right, and there you can see the lesser wing of the sphenoid right there. So that's another view of the sphenoid. So now we're looking at a posterior view of that sphenoid, and you can tell because the skull is, you see the back of the patient's head or skull. Here's the greater wing of the sphenoid, okay, posterior aspect of it. Here's the lesser wing of the sphenoid. Here's that supraorbital fissure right there. Foramen rotundum. Here's your medial pterygoid plates. And one of the biggest things you have to know is this is the basisphenoid, or the base of the sphenoid. And however that moves is that's really important, because that's going to determine how we name the sphenoid moving later on as we progress. We're now looking at a lateral view of the sphenoid. Okay, as you can see, as you're looking at the side of someone's head, and you actually can see the sphenoid, the greater wing of the sphenoid is going to be right here. So you can see that on a skull. And this is called the sella turcica, and that means Turkish saddle. So you can see here's the back of the saddle, here's the front of the saddle, okay? So the dorsum sella is the back, dorsum meaning back. And also you have an anterior clinoid process that's part of this sella turcica, and here you have that posterior clinoid process. And this makes sense. You can see the lateral plates of that pterygoid process. You see the lateral but not the medial. And like we talked about, you can see the greater wing of the sphenoid on a skull. Now we're looking at a superior view, and you can see, hey, here's the top of the patient's head, or the top of the skull here. And again, this is the view you're going to see mostly in cranial, because this is the way you're going to treat them. And here you can see the beak of the owl right there, the rostrum. Here you can see the lesser wing of the sphenoids here, the top of the greater wings of the sphenoid here. Here's that sella turcica right here. Basisphenoid right in the back. You can see that foramen rotundum here, posterior clinoid process, anterior clinoid process. So you can imagine someone sitting in this sella turcica, right, in the saddle, and they're holding on to that anterior clinoid processes. And the dorsum sella forms the back of that. Again, this is how mostly we're going to see the cranium, as we're going to look at it from a superior aspect. Now, during flexion, the greater wings, and you're going to be able to palpate the greater wings through your index fingers, all right, it is going to move ventrally or anteriorly, laterally, and it's also going to move inferiorly. I can't show you on this slide it moving inferiorly, but it's moving in those three directions. And what's going to happen is that's going to cause the cranium to get bigger, right? You're going to feel the cranium get bigger, and it's going to look like Ernie. So Bert and Ernie, it's going to look like Ernie. Ernie's got a fatter head, a larger head. During flexion, the cranium gets fatter. So in this slide, it's to demonstrate and hopefully have you remembered that in flexion, those greater wings are going to move lateral, ventral, which he showed you before in the previous slide, but also down towards the feet or inferior. Now during extension, the opposite happens. The greater wings move posteriorly, okay, and medially, and superiorly. And so what happens is the head gets thinner, more elongated, and you're going to look more like Bert, okay? You're going to have that long, narrow head like Bert. When the cranium and the sphenoid go into extension. In extension, the greater wings of the sphenoid are going to move superiorly, in addition to them moving dorsally or posterior, and as we can see here, medially or towards the midline of the body, making the head again more like Bert, elongated and narrow. The patient's lying supine on the table and you're palpating movement of the cranial bones. It's your second digit or index finger that's going to be on the greater wing of the sphenoid. That's going to be right here, okay? And then that'll help you figure out if the patient's in flexion or extension. If it's in flexion, your second digit or index finger is going to they're going to move farther apart. They're going to go laterally. They're also going to move towards the feet, okay? And then in extension, both of your index fingers are going to come closer together towards the midline, and they're going to move superior towards you sitting at the head of the table. One of the things we will test you on, and so will the boards, is what axis is the sphenoid moving around in flexion extension, and what plane is it moving in. So let's get our plane. Here's our planes here, and we're going to make a sagittal plane. That sagittal plane is going to split the body or the cranium, okay, in half, all right? And then we're going to have a transverse or horizontal axis. And so during flexion extension, what's going to happen is the sphenoid is going to move in flexion extension in a sagittal plane around a transverse axis. So here we go. Flexion, you see the greater wing of the sphenoid moving inferiorly, and you see the basisphenoid in flexion moving superiorly. And this is occurring around a transverse axis in a sagittal plane. Whereas in extension, the greater wings of the sphenoid are going to be moving superiorly. The basisphenoid is going to move inferiorly. So during extension, greater wings of the sphenoid, you see them moving superiorly, and you see the basisphenoid clearly moving inferiorly. Perspective at the top or the head of the patient, the superior aspect of the patient, okay, here's that transverse axis, here's that sagittal plane splitting the left and right side of the patient, okay, and so that is the axes, and that is the plane in which flexion and extension of the sphenoid bone is going to occur. Let's look at how the sphenoid moves in both flexion and extension. Okay, so we're looking anteriorly at the sphenoid. Here's the sphenoid sinuses right here. Here's actually the orbits, back of the eyes, okay? All right. How we're going to look at those, the patient's going to be supine in front of us, top of the head towards us. So let's make this orientation here. So here's a posterior aspect, and we want the superior view. So here's our superior view right here. All right. Here are the top of the greater wings of the sphenoid. Here's Here's the lesser wings of the sphenoid. Here's the basisphenoid in this right here. Okay. During flexion, what's going to happen is the greater wings are going to move a little bit anterior, okay, a little bit laterally, and they're going to move inferiorly. And you see the basisphenoid move towards you if you're sitting at the head of the table, or superior. So here we go. Flexion. See the basisphenoid move superior. See the greater wings move inferior, laterally, and anteriorly. Now, in extension, what's going to happen? The basisphenoid is going to move inferiorly, okay? The greater wings are going to move superior, medially, so they're going to come towards the midline here, okay? And they're also going to move posteriorly. So watch, here's extension, there's extension, flexion, extension, flexion, extension. Now that's exaggerated, okay? But that's how it moves. To remember, flexion and extension, all right, the patient's supine in front of us, top of the head's facing us, is going to be in, here is our sagittal plane, all right, it's going to be in a sagittal plane, good, and it's going to be around a transverse or horizontal axis. There's your flexion and extension, there's your planes, there's your axes, and there's the directions that they're going to ask you about the greater wing of the sphenoids and the basi-occiput. Great. When you're assessing the cranium or the cranial bones or doing treatment, a lot of times you're going to be in the vault hold. So it's important you know how to the correct finger positioning. So your second digit or your index finger goes, here's the greater wing of the sphenoid. It goes right on that greater wing of the sphenoid. Okay? Your third digit or your middle finger is going to go anterior to the external auditory canal, or your ear. Your ear is going to be right here. So there's second, third, okay? The fourth finger is going to be right on the mastoid process. And your pinky finger, or your fifth digit, is going to be on the occipital squama. So see, here's the occipital squama right here. Your pinky is going to sit right here. So this is what the vault hold is going to look like. There's usually a board question on where your finger positioning is for the vault hold. There you go. Now you'll be tested incessantly here and repeatedly here on where the fingers are moving when the cranial bones are moving into flexion and extension and various strain patterns, okay? So you have to be able to describe how my fingers are moving when the cranial bones are moving. All right, so the first cranial bone we're going to look at is the sphenoid. So you're going to have your second digit or your index finger on the sphenoid. So here's the sphenoid moving into flexion. It's moving laterally, so both the second digits are moving farther apart from each other, and they're moving towards the feet. That's flexion. Extension, they're moving towards the midline or closer together, and they're moving towards you or the top of the head. Extension. Flexion, extension, flexion, extension, flexion, extension, flexion, flexion. The second digits go farther apart from each other and they move towards the feet inferiorly. And then extension, they move medially and they move superior towards the head. Flexion, inferior and lateral, they get farther apart, the head gets fatter. And then extension, the head gets more narrow, okay, or skinny, and the fingers move closer together and superiorly.